Hello everyone, my name is Gerado Mackenzie. I'm an associate professor in the Department of Nutrition at the University of California, Davis. And today we're going to discuss on the improving our diet for disease prevention. And because my research focuses on cancer research and dietary interventions for cancer, I will have a special focus on cancer. So just before starting, I have nothing to disclose. I have no financial interest or any affiliation with any commercial organization that may have a material interest in the subject matter of my presentation. So what is health? So is health the absence of disease? Not being sick at all? Is that just what is health? Do we feel healthy as a sense of well-being? Is it the achievement of the genetic potential? Yes, we are all different, so we can have different achievements of what we can think about health. Or is it the ability to play your favorite sport at 75 when you turn 75 years old? Maybe you would like to still be playing tennis or soccer, for example, for my case. Yes, what is clear is that the definition of health is evolving over time. Yes, and this debate continues not currently. It's still ongoing. So, however, what is typically agreed on is that health is more than a simple absence of disease. Rather, it includes physical, mental, and social well-being components. Similarly to health, we can discuss that the definition of a healthy diet, what is a healthy diet for each one of us, is also fluid. So a fact of healthy diet, yes, is that most people in the United States don't eat a healthy diet. We consume too much sodium, saturated fats, and sugars, that this increases our risk of chronic diseases. Also, we do not consume enough fruits and vegetables. And unfortunately, there is a lot of people that consume at least one sugary drink every single day. And this has harmful effect on our diet, yes, on our health. So the harmful effects of poor nutrition are overweight and obesity, or increases in overweight and obesity, increases in heart disease and stroke, type 2 diabetes, and cancer. So these increases in chronic diseases are clearly associated with poor nutrition. So there's a lot of things, simple things, that we could do to improve our diet and minimize our possibilities of developing these chronic diseases. In particular, for today's talk, we will discuss about some things that we could do to mitigate or prevent cancer development or cancer risk. For example, as you can see from this slide, this is the estimated percentage of cancer deaths attributable to select factors. Yes, and these factors are modifiable risk factors for cancer developing. So we could do simple things to change these factors and change our risk to developing cancer. As you can see from the slide, we have tobacco as the higher one, around 20%. However, the next bar graph is excess body weight, alcohol, poor diet, and physical activity. So we have excess body weight, alcohol, poor diet, and physical activity. Those are clearly modifiable risk factors that we could do with our diet, with our physical activity, and this would have a huge impact in our risks to developing cancer. So for cancer, there are three main areas that we have to understand when we think about understanding the risk for cancer developing. So there's the genetics and personal history, there's the environment, and the lifestyle. Yes, and particularly the lifestyle is something that we can definitely tackle with our day-to-day things, such as non-smoking, such as improving our diet, or exercise or physical activity. So this slide discusses the hallmarks of cancer and how multiple factors that are related to diet and nutrition, as well as physical activity, could influence these factors that are related to what is the tumor cell and the hallmarks of cancer. Yeah, so if we look at the circle in the middle, you can see that the tumor have several specific characteristics or processes. This includes sustained proliferation, evading cell death, inducing angiogenesis that will feed the tumor, or, for example, tumor-promoting inflammation. all these processes that are characteristic of a tumor cell can be influenced by many of the other factors, such as obesity, physical activity, or certain nutrients. So that's why our diet, as well as physical activity, can play a huge role in how we feed the tumor, or how we prevent from feeding the tumor, for inhibiting the tumor growth. So that is why I think this slide clearly shows these processes in a more scientific perspective. So based on the clear fact that nutrition and food and physical activity plays an important role in cancer growth, there has been many attempts, many efforts to study how food, nutrition, and physical activity can prevent the cancer risk or mitigate cancer risk. So there has been a lot of effort from the World Cancer Research Fund and the American Institute of Cancer Research regarding studying the role of nutrition, physical activity in the prevention of cancer. And after a lot of studying, they have presented 10 cancer prevention recommendations. And again, these are not specific for cancer prevention, but also they could be applied for many other chronic diseases that we mentioned early on. These cancer prevention recommendations include: be a healthy weight, be physically active, eat a diet rich in whole grains, vegetables, fruits, and beans, limit the consumption of fast foods and other processed foods high in fat, starches, and sugars, limit the consumption of red and processed meats, limit consumption of sugar-sweetened drinks, limit alcohol consumption, do not use supplements for cancer prevention. For mothers, breastfeed your baby if you can, and if you develop cancer, after cancer diagnosis, try to follow these recommendations. So after a lot of research studies and evaluating a lot of research publications, the World Cancer Research Fund and the American Institute of Cancer Research developed these cancer prevention recommendations that are supported by solid research. So we will be discussing all of them in order, but particularly what can we do? What simple steps I think can we do to try to adapt our diet and our lifestyle towards these recommendations. So the first one is to be a healthy weight. Yes, we should try to keep our weight within a healthy range and avoid gaining weight when later in life, in the adult life. So again, these are basically achieved by two main factors: healthy eating and the physical activity and exercise. So what the research says, it is that having overweight and obesity increases the risk for 12 different types of cancers. So here you can see in the graph, the most common ones that are increased by obesity and overweight are listed here. Yes, liver cancer, for example, postmenopausal breast cancer, ovarian cancer, colorectal cancer are some of them. But this list of 12 cancers have been clearly shown that are increased in individuals with overweight and obesity compared to normal weight individuals. So this is in a more scientific presentation. You can see here the 12 cancer types, and I'm just highlighting, for example, the box for breast cancer, where the evidence is clear for postmenopausal breast cancer, where it increases the risk by 10%, the relative risk being 1.1. So, but you can see that this risk is different for many of these cancers, but however, clearly shows that excess body weight is associated with an increased risk for developing these types of cancers. So what can we do? Again, we should try to focus to eat healthy and be physically active. So I think those are key aspects that we can do, simple things that we could do to try to keep our weight within the healthy range. The second recommendation is to be physically active. Again, we should try to walk more and sit less. Yes, following or exceed national guidelines, the World Health Organization advises at least 150 minutes of moderate intensity exercise, or at least 75 minutes of vigorously active activity weekly. Yes, things that we can do is limit the sedentary habits that we all have, yes, especially now with screen time. Yes, maybe try to avoid that or minimize as much as we can. Yes, what the research says about this related to cancer. Yes, physical activity can help to protect directly from 3 types of cancer: breast cancer, colorectal cancer, and endometrial cancer. However, as you can see in the light blue box, physical activity may also decrease the risk of esophageal cancer as well as liver cancer. So, and besides the risks for cancer, being physically active can also help the weight control, as we discussed in the previous recommendation, and improve our quality of life. For example, for breast cancer, there has been a lot of studies, and this one is a meta-analysis that includes several, like 38 cohort studies, and where you can see that physically active women had between 12 and 21% lower risk of breast cancer than those that were least physically active. Is physical activity beneficial for breast cancer survivors? Yeah, this study clearly shows that, again, if you develop breast cancer, yeah, it would be beneficial trying to start being a little bit more physically active. Yes, as has been shown that 40% lower risk of death from breast cancer than those that were least physically active, clearly showing the benefit of increasing our physical activity to improve survival. So what can we do? Again, sometimes it's difficult, yes, again, but we should start somewhere. Yes, work out at least 30 minutes. Just keep it in your calendar. Add it there, yeah, per day. It doesn't have to be strong, yeah, just increase that step by step. Yeah, get up, walk during TV commercials. If you're working on your computer, yeah, just stand up, put your timer. Yeah, just stand up every 40 minutes, yeah, for 5 minutes, just for a walk. Go back and forth, yeah, just and stretch. Yeah, take the stairs over the elevator. My office is in the 3rd floor. I tend to, in the morning, just go up and take the stairs instead of the elevator. Yeah, I see, you go to a shopping mall and you see people just with the cars going over and over, trying to find the closest spot possible for the shopping mall, yeah, or to the grocery stores. Just park a little bit farther away and just take those extra steps into the store. Yeah, those things like would help. Yes, there are small steps, but we can do it, and just to achieve becoming a little more physically active. So the 3rd recommendation is to eat diets rich in whole grains, vegetables, fruits, and beans. So we have to aim at eating at least 30 grams of fiber, and these are some examples, yes, of great sources of fiber. You have lentils, black beans, avocado, green peas, raspberry, oatmeal. Yes, so try different ones, yes. And then regarding fruits and vegetables, yeah, aim at least 3.5 cups of vegetables and fruit every day. So how does a cup look? Like a small apple is one of it, yeah, or small grapefruit. So these are just examples. Choose variety, yes, choose like fresh, frozen, or canned, all count, yeah. Even canned may have higher salt levels, but still, again, for the amount of to reaching this goal of 5 servings or 3.5 cups, all count. Choose more whole grains, yes, slice of bread or brown rice instead of white rice. Just switching these things can be a good source of increasing the amount of whole grains that we are consuming. For example, in the breakfast, instead of having a toast made out of white bread, maybe switch it for whole grain bread and do a toast with that one. Yeah, that will just make smaller steps towards achieving or increasing the amount of whole grains in your diet. So what does the research says? Research shows that there's a strong link between dietary fiber and whole grains protecting against colon cancer. For example, as you can see here from this meta-analysis, yeah, even though this is a complicated graph, if you see that straight line at the 1, most of the studies clearly show that fiber intake can reduce the risk of colorectal cancer. Yes, the majority of them varying from the relative risk, but it is consistent that the majority of these studies have clearly shown that consuming diets that have higher intake in fiber can reduce the risk of developing colorectal cancer. So what can we do? We just mentioned some of these ideas. Yes, work for adding more plant foods in your meals or in your snacks. Yes, switch some of the maybe sugary or high carbohydrate snacks for maybe almonds, yes, or nuts, or a fresh apple, for example. And as you can see on the right, you have the new American plate. What you can clearly see from here is that the amount of animal protein is 1/3 of your plate. You should aim to achieving just 1/3 of the plate, and the rest should be consumed, the majority of, for whole grains, vegetables, yes, and beans, as much as possible. Try new food choices, yeah? Try different small swaps, yeah, that you can do to achieve this new American plate. So the fourth recommendation of the American Institute of Cancer Research is to limit the consumption of fast food. The problem with the fast food is that it increases the body weight. These foods tend to increase weight gain. So we should try to avoid, as much as we can, fast food and processed foods. What does the research say about this? Is that cutting down on processed foods and drinks that are high in fat and sugar means that we are less likely to gain weight. So as we mentioned in the first recommendation, body weight is a huge contributor to increasing the risk of 12 different cancer types. So by minimizing the amount of processed foods and drinks, we minimize the chance of increasing our body weight, and by then increasing the chances of developing these cancers. So what can we do? It basically is we should try to swap. Yes, if we're looking into this nice, colorful, rainbow-type donuts, yeah, instead of maybe choosing a donut or a big cookie, yes, we can maybe swap it by almonds or nuts or maybe an apple, yes, something that it will be less sugary or processed, yes. So I think those healthier alternatives could lead a strong way for it. The fifth recommendation is to limit the consumption of red and processed meats. Eat no more than moderate amounts of red meat. Yeah, this should be between 12 and 18 ounces per week. This is what is recommended by the American Institute of Cancer Research. So if we look at this, regarding red meats, for example, beef, pork, or lamb, yeah, we should try to not more than 3 portions per week. Looking at processed meats, we should try to consume very little, if any, of these. Yeah, ham, bacon, and hot dogs. Yeah, this is because of its high, maybe nitrates, high in salt, sorry. So those we should try to avoid as possible. So what does the research say about this? Yeah, there's a strong evidence that consuming too much red meat or even small amounts of processed meats can lead to increases in colorectal cancer risk. So similarly to the graph shown in the fiber slide, you can clearly see you have that vertical line at 1, and you can see all the black squares. You can clearly see them in this case to the right, showing that there's an increase. All these different studies have shown an increase in the risk of developing colorectal cancer in people that consume higher amounts of red meat compared to the people that consume less amount of red meat. So what can we do to limit the amount of red or processed meats that we eat? Yes, we should rethink our plate. Remember the new American plate, maybe that 1/3 of the animal protein. Yes, maybe we can replace some of that meat. Yeah, in the breakfast, maybe if you're eating sausage and bacon, maybe you can replace it with something else. Yeah, granola, for example. In the lunch, maybe if you're eating sandwiches with processed deli meats, maybe switching it for other alternatives. If you're grilling, yes, instead of choosing hot dogs or hamburgers, maybe select a fish, yes, or maybe chicken. Yes, that's your options for it. So these are some ideas that you could do just to minimize the amount of red or processed meats that we are consuming. So the sixth recommendation of the American Institute of Cancer Research is to limit the consumption of sugar-sweetened drinks. Yeah, this includes, for example, colas. Yes, do not consume these sugar-sweetened drinks, sodas, sweetened coffee or drinks, or sports beverages, or fruit drinks. Yeah, choose water or unsweetened drinks. Yeah, coffee or tea, or water infused with some fruits or herbs. Yeah, those could be some options. It is clear that sugary drinks lead to increase in body weight, in weight gain. And this, as we mentioned in the first recommendation, the increase in body weight and obesity can lead to the increase in the risk of developing these 12 types of cancers. So trying to limit the sugar-sweetened drinks is very, very important. So what can we do to limit these sweetened drinks? Again, water is the best option, yes, or unsweetened drinks. Yeah, for example, your tea or your coffee, try to maybe enhance the flavor by adding spices instead of sugar. Yes, like cinnamon or nutmeg. Yes, the unsweetened tea, for example, enhance the flavor by adding frozen fruits or fresh herbs. And try to avoid these fruit drinks. Yes, these are 100% fruit juice. Usually those have high levels of sugar. Yeah, so try to avoid or limit it to maybe 6 ounces per day. The seventh recommendation is to limit alcohol consumption. And regarding cancer prevention, what the research says is that the best is not to drink alcohol. Yes, and if you drink alcohol, follow the national guidelines, no more than 2 drinks per day for men, no more than 1 drink per day for women. Yes, and what counts as a drink, as you can see in the blue box or the blue rectangle, yes, 5-ounce glass of wine or a 12-ounce bottle of beer, for example. Yeah, so this is what would count as a drink. So again, if you drink, try to follow the national guidelines as much as possible. So what does the research say? Again, drinking alcohol is a risk factor for 6 types of cancers. So that's why not drinking any alcohol is the best to protect against cancer. Yeah, and this is the list of the 6 types of cancers that are associated with increased alcohol consumption, such as liver cancer, stomach cancer, breast cancer, colorectal cancer, esophageal cancer, and mouth, larynx, pharynx cancers. So what can we do to limit the alcohol consumption? Just get creative. Yeah, choose sparkling or infused waters and teas instead of alcoholic beverages, or put a splash of wine or juice into a glass of sparkling water to make your own spritzer. The 8th recommendation is do not use supplements for cancer research. Try to aim to meet your nutritional needs through diet alone. Those vitamins and minerals, those micronutrients, try to aim to get the amount that you need just through the diet. Yeah, what research has shown is that high doses of dietary supplements have not consistently demonstrated a protective effect of these micronutrients on cancer risks. Even worse, some of these studies have shown that they haven't shown an increased cancer risk in those participants that had higher intakes of these supplements. So what can we do? Again, let's revisit the new American plate. If you choose variety of vegetables and fruits, those are packed with micronutrients, with vitamins and minerals. So by having this variety in the fruits and vegetables, you will be obtaining or gaining all the micronutrients that you need for your daily needs. Yes, discuss the supplements and gaps in nutrition with your healthcare provider. Yes, for certain conditions, of course, these supplements are appropriate, are needed, but not for general population. Yes, in general cases, we can aim at obtaining these minerals and nutrients, vitamins through our diet alone. For mothers, the 9th recommendation is to breastfeed your baby if you can. Breastfeeding is good. It has been demonstrated that it is good for both the mother and the baby. And this is what the World Health Organization recommends. It recommends that infants are exclusively breastfed for 6 months, and then up to 2 years of age or beyond, alongside appropriate complementary food. So what the research has demonstrated is that breastfeeding is good both for the mother and baby. It helps protect the mother against breast cancer. And having been breastfed helps protect the children against excess weight gain, overweight, and obesity. So the 10th recommendation is that after a cancer diagnosis, try to follow the AICR's recommendations if you can. These are the American Institute of Cancer Research recommendations. Check with your healthcare professional, of course, about if this is right for you. But all cancer survivors should receive nutritional care guidance on physical activity as well as their diet. So we just covered all the 10 recommendations, but is there any evidence showing that these recommendations work? Here there is some studies that have been performed trying to clearly show that the adherence of these recommendations have a huge impact on cancer risk as well as total mortality. If we just focus on cancer risk to the side, you can clearly see that as we increase our adherence to these recommendations, we reduce our cancer risk, going all the way to 20% reduction if we are able to adhere to at least 6 of these recommendations. On the other hand, even better, on the right, you can see the total mortality graph. You can clearly see that even with 3 recommendations or 4 recommendations, you're already seeing a 15% reduction or a 24% reduction in total mortality compared to individuals that do not adhere to at least 3 or less than 3 of them. And even if you are able to adhere to at least 6 of these, your total mortality can reduce to all the way to 38% reduction. So clearly, this piece of evidence clearly highlights the benefit of adhering to these recommendations, not only for cancer risk, but also for different chronic diseases. So in summary, what I wanted to just highlight is that we can take small steps towards improving our diet to preventing chronic diseases. And these are small changes that we can do. Being a healthy weight, be physically active, try to increase our diets rich in whole grains, vegetables, fruits, and beans, limit the consumption of fast foods or foods that are high in fat or sugars, limit the consumption of red and processed meats, limit the consumption of sugar-sweetened drinks, limit alcohol consumption, do not use supplements for cancer prevention. For mothers, breastfeed if you can, and follow these recommendations as much as you can if you, again, in the case of developing after cancer diagnosis. So these are, I think, simple steps that we can do to improve our diet, to have a healthier diet, and this could have a huge impact, again, not only on cancer, as we stressed in the majority of these examples, but also in other chronic diseases, such as diabetes, stroke. So try to do as much as you can, step by step, trying to adhere or changing your diet to improve your health. And thank you for your attention.